My name is John Laniers, and I'm Muriel Laniers' brother-in-law. Muriel was a wonderful, vibrant woman who unfortunately contracted cystic fibrosis at the age of 50 and unfortunately succumbed to the disease at the age of 56.
My name is Paul Laniers, and Muriel Laniers was my sister-in-law. She was somebody that had a background in insurance. She had great coverage, and even she struggled with getting the necessary things that she needed, and saw other patients in the clinic who weren't as fortunate as she was. And so towards the end of her life, Muriel asked that we make sure that the things that she didn't use, such as the tubes and the bags and those types of things, be given to the patients.
And as we grieved her loss, the family got together, and my brother Paul came up with the idea of trying to raise money for the cystic fibrosis cause. We decided that we weren't going to necessarily just give it to the Cystic Fibrosis Foundation, but that we were going to try to help support the patients in the clinics. Muriel had asked us that almost on her deathbed, as she recognized the need for a lot of out-of-pocket expenses that she's had.
My name is Joe Paluski. I'm an adult pulmonary and critical care physician. My role is to work as the director of the Adult Cystic Fibrosis program at Children's Hospital and at the University of Pittsburgh Medical Center. I'm a physician who had the privilege of taking care of Muriel for a number of years. In the process of caring for her, I had worked some with her family, and then after she expired, I spent some more time with Paul and John and Les and the rest of the family, and they brought this idea to us that they were interested in raising some funds to help offset some of the costs that we have for adult care that is currently not provided by insurance companies. Many of our patients with CF have health insurance that covers most of their medical costs in terms of their physician visits and testing and hospitalizations. There are a number of unmet needs that are very hard for patients to provide. They vary from things like medication copays. In the last couple of years, we've had insurance companies paying less and less towards medication, so that patients are responsible for a greater proportion of their medical costs. In some cases, these amount to hundreds, if not thousands of dollars a month, and can be a significant burden. The other challenge that many of our patients face is they live far outside of the Pittsburgh area. So they have travel costs associated with driving to Pittsburgh for their routine care. So the Muriel Fund has been incredibly valuable to some of those patients who are of low financial means. And while they may have health insurance, they don't have the money to provide their transportation to come to Pittsburgh and get the care that they need.
Since 2010, we've raised about $210,000 with a yearly picnic, sponsors that we got. We've done golf raffles, we've had different fundraisers.
So that staff has let us know that oftentimes they can't think of sort of what life would be like without the support of the fund. Our family also recognizes that we're actually not going to be here forever, and that that we can't imagine not creating a mechanism for the support for these patients. And so the only way to enable that would be to create an endowment that would be large enough to support the needs of the clinic, which is around $25,000 a year.
The goal of the endowment is to create a fund of about $500,000. There's not any other source that can provide the types of things that Muriel's Breath of Life Fund is giving. If we can create an endowment that will generate that kind of revenue, then that can continue to go on until hopefully there's a cure found for cystic fibrosis.
Fortunately, we have $100,000 already, so we still have a rather large sum to tackle. So what would be wonderful is for people to see the mission and hear it and support it financially, support it with fundraising events, any way that would allow us over the next few years to get closer to that $500,000 number.